Buenas and half a day to our listeners on Guam and in the CNMI. It's now time for Total Health right here on Joy FM Radio, where your questions get answered by health professionals. If you have any health-related questions, we would love to hear from you. Call your questions and comments in at 472-1111 or text or WhatsApp 686-9999. If you're in the CNMI, please call 323-1113. Welcome everybody to Total Health.
Welcome everyone. We are back with more Total Health, and here we are, the SDA team again. And today I have a very interesting topic. Maybe you'll say that this is something that belongs to the past, it does not relate to us nowadays, but you might be surprised because we still have some cases in Micronesia and as well in Guam with leprosy. Yes, right. We're going to talk about leprosy, and we're going to talk about leprosy, leptospirosis, what's the difference, if there is a difference. And feel free to ask us any questions, any related questions to the topic today or health-related questions. So I have today a very, very, very special guest. And it's not only a colleague of mine, she's a friend of mine, and that's Dr. Anna Ursales. Hi, Anna.
Hi. Hello, good evening.
We're so excited that you are here and you can give us a little bit more, information about the topic. And after that topic, I promise you will know everything you need to know about leprosy. Anna is not only an internal medicine physician, she's also an infectious disease physician. And we're so blessed to have you at our SDA clinic. You have been helping our patients with infectious and non-infectious diseases. But today we're kind of challenging you to go in the past, in the present, and in the future about the condition of leprosy. So, Anna, welcome here, and thank you so much for, being willing to share with us your insights and your knowledge.
Thank you for having me. It's a pleasure being here.
Fantastic. So, when we talk about leprosy, we'll say, oh, that's something that happened in the past, in the Bible. We heard that in Guam, maybe there was some leprosy, but you will be surprised. When I came to Guam, I researched. I wanted to make sure I come prepared. And I learned that every year we have at least 3 cases of leprosy. Maybe some of you know more numbers, but this is what I learned. And on my first day of clinical work at the clinic, I had diagnosed a patient with leprosy on the first day.
Wow.
So it is more common than we can, we are aware of. And we would like to know what are the signs, what does it mean to have leprosy, but that doesn't mean you have to stress out with every single wound you might have right now. Anna is going to give us a little bit more information about it. So, Anna, what is leprosy? Is it a disease? It's a disease. We know it's a terrible disease that you can die from it, but is it a bacteria? Is it a virus? Is it a fungus? What is it?
Sure. Leprosy is a bacteria that actually is related to tuberculosis. So they're kind of cousins, except tuberculosis is more contagious than leprosy. Only about less than 2% of people who've been exposed to leprosy will actually get it. And it takes 15 to 20 years before they even start to develop symptoms. And a lot of times these are in patients with weakened immune systems. Some children, others who are sick with other underlying comorbidities. I know leprosy was really big in biblical times even. But now it is a disease that's very curable. Even though there is still stigma right now, it's very hard to actually get the disease. And you can't get it, just by touching someone or sitting next to someone or sharing utensils with anyone. So.
Wait a bit. I always thought that leprosy is very contagious. And you're telling me it's not as contagious and actually takes such a long time to develop it. What do I need to do in order to develop it? Do I need to share utensils with somebody, live with it? How can I contract it? I thought it's very contagious.
Right. So we don't necessarily know the exact way in which it's transmitted. The thought is that it is through the respiratory route, which is similar to how TB is. So we would still take the same precautions as if you had a cold. Wash your hands. Just don't sneeze into your hands. Just try to sneeze away from others. But even then, because it's not very contagious, there's not really much we can do other than make sure that you have a good, healthy immune system so that you'll keep the bacteria from being activated.
We do have cases still in Micronesia. Still in the world, we know that after the discovery of the sulfonamides or certain antibiotics, the leprosy was declared curable.
Mm-hmm.
And we are very proud of that, because the humanity was able to manage the disease. But there are still areas in the world that they do have it, and the most it ranks in India and Brazil. And we do have it in Micronesia. We do have it in Guam. And you'll be surprised that in the past, there were actually 3 leproriums or places that people have been treated for leprosy. And when actually the Spaniards came, the Spanish people, they discovered that the whole island in the 1600s, many of them had leprosy, and they didn't know from where to start. And what was interesting about the Chamorro culture, talking about Chamorro, and we are in the Chamorro Mass right now, celebrating the festivities, Chamorro people are quite comfortable with themselves.
Right.
They were not concerned that leprosy might be contagious. So they will still continue socializing, and even though they had leprosy, they will still continue being around each other, eating together. And so the Spaniards were very concerned. They said, wow, we cannot help them. And so they started even finding them, isolating them. And they had to put very strict measures in Guam to isolate leprosy. Maybe you know some statistic as well.
Right. So there have been about 149 cases within the last 10 years here in Guam, and most of them were contracted from those who came from Micronesia. In fact, there are about 23 countries that the World Health Organization has declared priority countries in which to eradicate leprosy. And you mentioned Bangladesh and India. So Micronesia is actually one of them, as well as Kiribati. So those are the 2 main islands. And in some sense, we know why it's so endemic, because as we talked about, it's more common in patients with decreased immune systems, which go along with poverty or crowded living conditions and things like that. So.
Right. It wasn't long ago, and I think still in Pinjalap in Marshall Islands, there are people that are isolated there. And many people have been also isolated in Saipan, when they were trying to eradicate it in Guam. And also nowadays, we still have in Kapiramangi, in Ponape. We have in Nauru. Nauru has a high caribous, as you said. We still have that presence of leprosy. And so I'm hoping today we will just know what to do if, we happen to know somebody that has contracted leprosy.
Right. And leprosy is a disease mostly of the nerves. So what happens is the longer you have the bacteria, it can destroy your nerves so that you lose feeling. So many of the long-term consequences of people involve deformities or amputations because of all the injuries. Like if you burn your hand, they're not able to tell that they're on fire, and so then they end up with those kinds of diseases or complications. It can also lead to blindness, again, if it involves the nerves of the eye. So it can be quite devastating. But the one thing that take-home point is that leprosy is treatable. Other than in the olden days where you had to be isolated, just a few doses of the medications can pretty much eradicate the bacteria. So it's important that if you have somebody that you live in close proximity, to be checked before it so that you can start treatment right away and not even develop any of these symptoms.
I am so pleased to hear that, whoever invented, the Dapsone antibiotic or those sulfonamides, they deserve like more than a Nobel Prize, because that has really curtailed the burden of leprosy. And even though we still have it nowadays, we have hope for it.
Right.
I also have heard, maybe you can give us more information, that it is quite resistant. It can be quite resistant, leprosy. I've heard cases even in Guam, patients that had to be hospitalized and had to be even on treatment for a year.
Well, normally the treatment it spans from 1 to 2 years, and it's not necessarily. I feel like the bacteria that you can't suppress. It develops one of the immunologic reactions. Actually, there's 2 types. That when you get the bacteria, your body goes into this, fight mode, and your immune system revs up to try to fight off this bacteria, and that's what causes a lot of the symptoms, actually, and it can flare at any point. So then some people need high-dose steroids, which also then depresses their immune system, and then they're susceptible to infections. But, we know that it's hard also to do the resistances because you can't really grow the bacteria on culture. So we kind of go by with what you see on pathology.
Oh, I see.
Yeah.
Like a kind of a more clinical diagnosis.
More clinical diagnosis, correct.
Where do we isolate the bacteria from to diagnose? Is it the saliva, the nasal secretions, the blood?
So the way it leprosy presents, it's mostly the skin. You can see discoloration. You can see like flakiness of the skin. I've seen some with red spots, like on the chin or anywhere in their bodies. It's very interesting because I actually had a patient who diagnosed himself with leprosy based on the fact that his uncle had it, and they were in close proximity to each other. So he said, I'm here, I could have leprosy, and all we did was do a biopsy, and we confirmed his diagnosis.
Oh, wow.
Yeah, so a lot of times you have to biopsy the actual lesion and then look at it under a microscope to be able to see the bacteria.
That's so interesting. What I know is that leprosy comes from the word leper from Latin, which means a scale. So it is very easy to mistake a scale. I know that in the past, especially in Molokai, a Kalaupapa place where there were many people isolated there, they would just send everybody with any skin condition. You have a scale, psoriasis, you go there because we don't know if it's a leprosy or not. So after the break, we will get to know exactly how we can, suspect that we might have it or we actually don't have it.
We'll be right back after this quick break. Call in your question. On Guam, 671-472-1111. In the CNMI, 670-323-1113. You can text on WhatsApp in your question to 671-686-9999. We're streaming live on Facebook. Go ahead and leave your comments in the comment section below, and we'll get it answered right away. We're listening. You can listen live online, joyfmradio.net. We'll be right back.
It's a building on a piece of land, housing equipment that sends a signal to a tower that is sent to your radio. And it's not enough. Joy FM is as good as wire, wood, and cement without God's guidance and your support. If we have any kind of success, it's because we're not alone in this work. And that's some kind of encouraging. Thanks for praying for us and extending much needed financial support. Joy FM, family-friendly radio.
Si Joe Moasi, and thanks for listening to Total Health on Joy FM. We want to hear from you. Call in with your health-related questions at 472-1111. In Guam or in the CNMI, the number to call is 323-1113. Text or WhatsApp us at 686-9999. And now, back to the show.
So we are here with more Total Health, and the topic for today is leprosy. We have Ana Ursales, Dr. Ana Ursales, infectious disease and internal medicine physician. We were talking that leper actually means a scale. And so, Hannah, how do we know that any scale that comes on our skin, it might be or might not be leprosy?
I think that the key characteristic is that these areas, you lose sensation in these areas. So that is a big clue. Of course, if you see areas that are also reddish color that are continuing to progress, but the main thing is like we actually check with one of the either a needle or some device to see if there is feeling on those lesions, and that would be where you would suspect it to be leprosy.
So if I puncture myself with a needle and I don't feel anything, I should seek some doctor's attention.
Right.
Okay, that's interesting. We did get a phone call, and the question is, can leprosy actually lead to permanent disability?
Yes, it can, depending on how serious the actual disease was or how far along it was diagnosed. Because as we had mentioned before, it is a disease of the peripheral nerves. So in some patients who are undiagnosed, and like I said, they left without feeling in these limbs, then they can be blind. They can lose like an arm or a leg because they burned themselves and didn't feel anything. There's also some, they call it saddle nose deformities, which they have a specific way that the nose looks because it also infects the nasal passages. So that's another area that can become deformed.
I'm just going to take a little bit of time to explain something that I really learned from a physician that was one of the first physicians that really took seriously leprosy, not the one that invented it, Hansen, the Norwegian
scientist.
Scientist. But another one, Dr. Paul Brandt, who really specialized, and I'm sure you know more about him. But what I was very impressed that he went to India and he decided to dedicate his life to God and to the population that suffers from leprosy. And he noticed that they would just go through the fire, and because they don't feel anything, they would just have fun on the fire. And, or they would try to build a church, and they were so passionate to do that. And because their hands were dissolving, the nerves were like really dissolving, they would just put their hand through the wheelbarrow to cut some of the fingers so they can go and continue building. Or they would see rolling potatoes going through the fire, they would just go and pick it up. Or they would burn themselves with hot water. And he said, whoa, those people, oh my goodness. He said, God, I appreciate the gift of pain the most. Yeah. Because the moment you lose that pain, you're either dead or you have leprosy. And it is serious.
Right.
And he said, from all the gifts, God, you have given us, I appreciate the gift of pain the most.
Oh, that's very deep. I didn't even really think of it that way, but you're right. Without pain, we don't know if there's something wrong, and that needs to be addressed.
Exactly. So he decided to go back to Louisiana, the Institute of Tropical Disease. Yes. And he decided to invent a glove that when he puts that glove on leprosy people, it's gonna lighten up to tell them that there is a pain or a problem and they should not do anything. And so he went back to India. He spent millions of dollars, the whole institute. And when he put it on leprosy hands, they would do things. It will lit up, but because it does not cause them pain, they will keep on going. And he thought that this project is terrible. And he was thinking, wow, what a useless project. And he said, maybe if I make this glove to shock them, they will react.
Yeah.
And so they started getting those shocks, and they did not like it. And but because they didn't feel pain, they kept on going.
Right. Oh.
Then he said, no, I have to find some way. And so it would tease them, like to a point that would really stop them. And they would not like it, and they learn where to turn off the button. So when they use those gloves, and they get this like a teaser, like kind of a sensation, they will turn it off. Then he decided to put that button for turn on and off on their backs so they cannot reach it. But they will ask their friends to turn it off. And he was thinking, he said, wow, how wise is God to take the control of pain away from human hands? Right?
That's very true.
Because if we don't feel pain, we will just keep on going until we destroy ourselves. If my knee does not complain, I wouldn't know that I have to do something for my knee. And at that moment, he realized that. And I would just say another story with him. When he was coming back to the States, one of those days, he was like walking to his hotel. He slipped and he fell in a ditch. He barely made it out of the ditch, got to his hotel, and in the morning when he woke up, he couldn't feel his leg.
Oh, my.
And he said, I got leprosy.
Oh.
He said, wow, I got leprosy. He started stabbing himself with a fork. And he was like, wow, I don't feel anything. He said, God, I will give anything that I may start feeling pain again. And he made some phone calls, but he couldn't move and all that. And after 2-3 days, one morning he woke up, he was able to walk. He was trying to get some medications for leprosy. And then he realized that he pinched a nerve in a sensory way that, did not allow him to walk. But he realized how important the gift of pain is. And maybe we don't realize it. Maybe we're giving a different, insight over the pain. But pain is a good thing. It really alarms us mentally, psychologically, physically. Pain is there for a reason.
And a lot of times, we try to numb it, but
suppress it, deny it.
Deny it. But yes, it helps us to realize that there's something wrong, so we can fix it.
Yeah, God placed the pain there for a reason. All those nerve endings for a reason. So in the States, what I know, I used to live in Florida, so we did have a quite high population of people with leprosy. And you would think, like, why would that be? But the animal, armadillo, we don't have it in Guam, spreads that disease. And many people that you have to actually live with them or eat them or be in contact with them. And many people in Florida that live in the fields, they actually can contract them. I read like stories, like 30 people, 60 people a year having, maybe more stories.
No, I think that, this is something interesting that I've found. A lot of times, we only know about the armadillo, but apparently there are like the red squirrels in UK.
Oh.
And even amoebas can also carry it.
Oh, wow.
But, so it's interesting to note that, even contact with those animals can lead to acquisition of the disease. But yes, like you had mentioned, people do eat armadillos, which I can't imagine how you would even do that. But yes, it's another way to think about how God taught us what kinds of things to eat.
Clean things, unclean things. You're very right.
Yeah. So.
And he also did tell us to strengthen our immune system, especially in those moments. It is very important, right, to eat very healthy foods, vitamin A, C, vitamin D, zinc, selenium, in those cases, and still not saying, okay, I have leprosy, that's it, I'm going to rely on medications, but you also need to strengthen your immune system. Because I also read that certain people are more genetically prone to the condition than others. Even though you might not contract it, some people might contract it and nothing would happen. As you said, only 2%.
Right.
So it is important to still take care of our bodies.
Yes.
You never know.
Yes.
Indeed. We have some time to talk about leptospirosis. It sounds like leprosy. Many times we don't know what leptospirosis is. We have been told not to go to certain rivers, not to have cuts on our feet when we are walking on a hike, and go to those springs in Guam, that we can actually contract leptospirosis. But what is leptospirosis? Is it spirosis like leprosy? Is it spirosis? What is it?
So leptospirosis is a bacteria that actually is a spirochete. It looks like a spiral, And interestingly, it's around the same class as syphilis too. That's also a
Tuberculosis,
a
syphilis.
spirochete.
Okay.
Yeah. So, but leptospirosis can be found in many animals, rodents, especially in their urine. And so, what happens, especially during rainy season, is you get the backflow of the water. And then here in Guam, a lot of cases have been related to those who go hiking and hashing and, all of those types of activities. As you mentioned, it can get into the body through tiny cuts or mucous membranes, which are present in, your eyes or your mouth, and drinking the water and all that. And leptospirosis can be fatal. It can present anywhere from 2 to 4 weeks after your initial exposure, and it's very hard initially to distinguish from like flu or the cold until you start seeing they call it conjunctival suffusion, which is redness in the eyes. In more severe cases, then you can start seeing kidney failure, liver damage, and that's what leads to death at times.
So how do I know I have it? Do I develop fever? Do I wait for those, the redness in my eyes to seek doctor's help?
I think the important thing to know is really exposure. If you've been somewhere near a body of water, and you're out there without any proper shoes that's covering your feet, that's definitely something to be worried about. Otherwise, like we mentioned, it's hard to distinguish initially from the flu because you'll have similar symptoms. So know that if, let's say, I was hiking up to, Tarzan Falls or something like on last Saturday, and then I started developing fevers, this week, and it's been especially rainy season, and you're not responding to any of the other treatments that you normally do when you have a cold, then it's time to seek care so you can get on treatment immediately to prevent any of these severe consequences. Yeah.
And so how do I get diagnosed and what do I get treated with? What do doctors do for it?
Unfortunately, leptospirosis is really hard to diagnose because we don't have a lot of good tests for it. So we diagnose it clinically. So basically, we look at your exposure history, your symptoms. A lot of times, we give you medication empirically before we'll even get the results. Otherwise, it would have been too late by that time. There's a lab in Australia, I think, that we can send samples to, but again, it'll take time, and so, we don't have time to waste in a lot of times. So.
This is so interesting, everything that you're sharing with us. Thank you, Anna, and we'll continue right after the break.
Call in your health question on Guam, 671-472-1111. CNMI 670-323-1113. Text and WhatsApp in your question to 671-686-9999. You can listen live online, joyfmradio.net, and we're streaming live on Facebook. Go ahead and leave your comments in the comment section below, and we'll get it answered right away. So what do you think about the topic so far? We're waiting for your question.
A store is supposed to have what you need when you need it. When they're out of stock, frustration can set up shop. It's tough for every expectation to be met or even exceeded, but it's nice when they are. You could lower your expectations, or you could listen here. We have what you need. No waiting, no long line, no need to shop around. It happens because our message is God, and our support is you. Thanks for keeping us well stocked. Joy FM.
Welcome back. You're listening to Total Health on Joy FM. Call in with your health-related questions to 472-1111 in Guam, If you live in the CNMI, we want to hear from you too. Call 323-1113 or text or WhatsApp us at 686-9999. And now, here's more Total Health.
Yes, we are back with more Total Health, and today we have a very interesting topic. We are talking with Dr. Ana Ursales, and we're talking about leprosy and leptospirosis. When we left at the leptospirosis, and we understood that that's difficult to be diagnosed, but is it easy to be treated?
Oh, yes. It's very easily treatable. There are two antibiotics that we normally give. One is called doxycycline, and the other one is penicillin, but it really matters how early in the disease you get treated for it. So
You said that it can be even lethal. Does that mean that patients would arrive late in the hospital?
Right. Because again, the symptoms are very similar to cold and all that, until patients start to see changes in your urine, which can signify like kidney damage or liver failure. So the most important thing to do is, number one, prevention. So either that is whether avoiding activities, especially during the rainy season, or making sure that you have the right equipment and the right footwear. The other thing is try and prevent actually rodent infestation. So cover trash bags, your garbage disposal areas, so it won't attract these rodents.
By rodents, you mean rats?
Rats
Or
and
do you?
mostly rats and mice is what we see in these parts, I think. Yeah.
Wow, that's interesting. And is there anything I can do in order to prevent myself from getting it? Maybe strengthen my immune system, or is just pure luck if you get it or not? I mean, luck on luck.
Yeah, I guess it's one of those two. It's one of those infections that can affect anyone of any immune system.
Even if you have a strong immune system.
Yeah.
Okay, we are going to be watching out for that. If we go hiking, we have to have it at the back of our mind.
Right.
That if we have scrapes on our feet, we might step into something. Would you recommend that when we hike in Guam, we'll have long sleeves, like long...
I would recommend it for many reasons. One of it, too, is the mosquitoes. So it can also cover you from mosquitoes and anything else that they will transmit. That and, sun protection. A lot of people burn easily, so the long sleeves would protect against that.
But if we get into a water, then, of course, it can go through the skin, right?
Right. So then, it would be, if you know that there's been a lot of rain lately and, you need to reconsider what kinds of activities you'll be doing. Also, shortly after a typhoon or a storm, you'll see a lot of, water from the hills or the mountains coming down, and there's a bunch of animals up there. It can be seen in cattle and pigs, and so if you're close to a ranch or a place that have these kinds of animals, then be a bit more diligent in looking out for these.
Interesting. You said something, and I know you're infectious disease specialist. I'm going to call you on that. I need an answer from you. You said, be careful from mosquitoes. Are there any mosquitoes that carry anything dangerous that we need to know in Guam?
In Guam, it's there's been talk about dengue, I think, most recently. The couple cases that we've had in the past have been imported from like the Philippines and things. But if I'm not mistaken, we do have the mosquito here that can transmit.
Okay.
Yeah.
So potentially. Avoid mosquitoes
Mm-hmm.
as needed. Wow, I am learning so many things. And if you do have any questions, we do have Dr. Ana Ursales with us today. She's an infectious disease, a physician, and internal medicine. You can ask your questions. If you were wondering about leprosy or leptospirosis or any other infectious disease, please give us a call. Ana, I was able to visit Kalaupapa, which is a small area in a Molokai, Hawaiian area. I am sure you're aware of that. That was an area that it had maybe one of the biggest colonies. There were
Mm.
8,000 people
Mhm.
with leprosy that were like really taken all the way from all the Micronesian and Hawaiian islands. And whoever was with any skin condition that was suspicious, they would just send them.
Mm.
And what was very interesting is while people thought that they are sent to hell,
Mhm.
they actually discover heaven.
Mm.
Because they, let's face it, they felt that, okay, we are all gonna die. Let's make some meaning out of our lives.
Mhm.
And they'll say that every day there will be people there that would die. At the same time, they had so much joy,
Mm.
and everybody was so brotherly.
Mhm.
Everybody would help, the other people, and they were like extremely supportive. There were different Catholics and Protestant missionaries that went there. Not many.
Mhm.
People were afraid.
Yes.
There were
except
all-
Father Damien, right?
Father Damien, he
Yeah.
was extremely brave, and when many people called out on
Mhm.
that task, he went there personally,
Mhm.
and he built a church. I
Mhm.
visited that church in
Mhm.
Molokai. It was very special. But what was I was really really touched about it, and I wish we as Christians we can implement it
Mhm.
in some way. So he would see them coming into the church,
Mhm.
and they will listen, but they will come out and come back.
Mhm.
Come out, and everybody will just step out, come back, step out. And he said, "What is this? I can't even preach. There's so much noise, people
Mhm.
coming in, coming out." And then one day he kind of confronted them, and he said, "Why do you have to all the time keep on coming in and out?" And they said, leprosy is causing us to have those nasal secretions. We have to go somewhere and spit it out. Otherwise, it is really bothering us.
Mhm.
And when he heard that, you know what he did? He built a place inside of the church that they will spit. Stay in the church, listen the gospel, don't go out, spit right there. And, and he did that for the church. And people realized how much he really, really cared for them.
Mhm.
He lived there. He was very young. I think he died when he was 46.
Yeah.
He dedicated.
He contracted
He did
the disease
contract it.
himself,
They were sharing everything together, so it wasn't like impossible to contract it.
Right.
And he was, what I was like very touched, and maybe I will repeat it several times. They had a song, and the priest Damien will say that, even if the disease claims my body today, I know that God will give me a new one at the resurrection day. And so they were like fearless. Even if the worst happens, and every day people were dying there, they will still be so happy, and they will like support each other. And there was so much love that the condition really crossed different boundaries.
Right.
Even no matter what religion you are, no matter what color you are, no matter what your background is, and no matter what is your social status, we are all sinners. We're all lepers here. We all gonna die one day. Let's love each other. Isn't that amazing? Can we implement it in our society?
I think that's amazing. Like you mentioned, even patients who have been cured from leprosy, they don't want to leave because they have found families, whereas in the outside world they could face stigma. I think in order to destigmatize these things, one of the first things definitely is education, like educating yourself about the disease and knowing that you can't, get it easily, that just because you brushed against somebody, you're going to get the disease. It's not, like we said, easy to acquire. And you mentioned how in the Bible it was one of those diseases that you actually had to scream unclean, unclean every time you go, walking somewhere down the street. But Jesus did not consider them unclean. He actually would, go touch them and heal them from the disease. And I think that's something that we can apply also to our daily lives. That just because somebody has, leprosy or
Contagious
conditions, doesn't mean that you have to lock yourself from the outside world. Like how they did in their colonies, helping each other and providing that kind of support, will make a better environment, I think, for us to live in.
Right, you said that very well. We need more education, because when we don't, we're afraid, we fear, and when we don't know something, we obviously build our barriers around it. But the person that came, a nun came after Father Damien to Molokai to serve the leprosy colony. She never contracted it because she will wash her hands all the time. At that time, they didn't know much about it. That's in the late 1800s. 1900s in the beginning, but she was convinced that she will not get it if she washes her hands and she minds her environment, and that was found to be very beneficial.
Right, and if you think about it, like you said, it's found in secretions, right? So it can be anywhere, found anywhere. When they sneeze, it'll land, where they touch the area. So hand washing, that's one of the first things we learned in kindergarten, and it's amazing that how we can, just carry that forward, and one of the best ways to avoid getting sick.
Right. And you also mentioned about how people were actually happy and they don't even want to leave. And when I visited Kalaupapa, they still have people that are living there. They recovered from leprosy in the 1960s, 69. But then they didn't know anything better. And that was the best place that they have ever lived in. And they said, why do we leave that place? We're actually happy. And the whole leprosy colony that stayed there and recovered, they are until today living there. And you can visit, their church. You can visit their shops. Everybody is so happy, and they absolutely value life much more. I'm thinking, do we have to really get to a level like that so we can appreciate life, so we can appreciate others, so we can understand that we are all brothers and sisters. We all have the same destiny. All of us are going to die. Nobody has come out of this life, unharmed apart from Jesus. He is the only one that resurrected. And one day he can give us even a new body, even if leprosy claims, our body at this earth. Do we have to do that? I know that's like more of a spiritual question, but can we just learn how to implement that joy that leper people had between themselves in our everyday life?
Modern day leprosy can present in so many ways. I'm not just talking about the physical type. We're talking. You mentioned, socioeconomic status, educational status, but just trying to, the golden rule is one thing to just keep in mind. Do unto others as you would want others to do unto you. I think that's one of the best ways to curb all of this hatred that can be directed towards somebody who is, of a different race or economic standing or anything like that, so we can really live more in peace with each other.
I believe that, and I'm learning those lessons. When I saw the joy and all those people that are remaining there, I said, everybody thought this is hell, but for them, that was heaven. I wish that for all of us.
Right.
We are going into our last break. We got about 12 minutes left into the show. Call in your question to 671-472-1111. That's on Guam, and in the CNMI 670-323-1113. Text and WhatsApp us 671-686-9999. We're streaming live on Facebook. Go ahead and leave your comments in the comment section below, and we'll get it answered right away. You can listen live online, joyfmradio.net. And thank you for your question. We'll be right back.
Maybe you've seen them hovering around. They're called helicopter parents. It's a new type of parent with a new type of obsession, hovering over their older kids more than they need to. You see, there's been such a concern in the past about parents not being involved in their kids' lives that some parents are swinging back too far the other way. Even after the kids are out of high school and into college, the parents are constantly calling and checking on their lives. Sounds good at first, except some of these helicopter parents are hovering just a little too close to their grown kids, calling the colleges complaining about grades, calling administrators complaining about the friends in the dorms. One set of these parents even called complaining about the substandard plumbing their daughter had to endure while she was studying abroad in China. This message is all about balance. Sometimes in life we fix a problem by going too far the other way. Have you faced problems in your life even back in your childhood that you're now trying to fix by going too far the other way? It can happen to all of us. Find some wisdom on balance in your life in the Bible. It's a great launching pad for a balanced life.
From Joy FM.
And we're back with more Total Health. Give us a call with your medical questions. Number to call in Guam is 472-1111. If you're in the CNMI, the number to call is 323-1113. Or you can text or WhatsApp us at 686-9999. Now back to the program.
Well, we are at our last segment of our radio show, and I am again here with Dr. Ana Ursales, our infectious disease specialist and internal medicine physician. Meanwhile, we got two questions, and they're related to leptospirosis. Anna, what are the main complications from leptospirosis?
So if you treat it early, you would hardly ever see any. But as mentioned, if it ever gets to that point where you have kidney failure and you require dialysis, or liver failure and you might need a transplant, and those are two really serious consequences of the disease. But you would hardly see that, especially because the treatments are so effective. But yeah, if those are two things that I can think of, if you get to that point where you have irreversible damage, then yeah.
So if we go on a hike and we continue to have a fever for several days and we're not feeling well,
Mm-hmm.
let's check with the doctor.
Yes.
Because consequences can be really drastic.
Correct.
Very,
Yes,
very
correct.
bad. And the other question is it a good idea to bring those water filter things when we go on a hike to prevent ourselves from leptospirosis?
Yes, I would definitely recommend not just leptospirosis, but there are other waterborne diseases that you can get, especially if you know that it's not one of those like really clear spring water, high altitude kind of things. I would definitely recommend water filters.
But we wouldn't recommend drinking the water from the springs, right? Or can we?
From the springs?
Yeah.
If it's an area where you're not even sure what's around, I would just avoid it.
Right.
Yeah.
Oh, wow. I would believe so.
Mm-hmm.
And also, surfers, as far as I know, in Talafofo Bay, they
Mhm.
also can be at risk of that because this is where the river flushes out.
Mhm.
And
Mhm.
surfers are famous to have some cuts there and there because nothing
Mhm.
stops surfers, not even rocks.
Right.
And they have to be watching out if they go surfing and they have some scrapes on their
Mhm.
body and they continue having some fever and some
Mhm.
nausea and not feeling well, dizziness, correct?
Right. Yeah.
Some of those symptoms, they have to seek help.
Yeah. I think one of my friends actually after Mawar went out swimming and ended up with feeling really ill, and we basically just empirically treated with the doxycycline just because of that piece of history, and didn't want to wait until she got sicker. So
Okay, so it is kind of a good thing to kind of start with a treatment earlier even when in doubt.
correct.
Wow, that is very, very good to know. So that's very encouraging, Anna. Thank you. We were talking about leptospirosis and leprosy today. I hope you learned interesting things. But if you do have questions, please, we'll be here 5 more minutes. Come back with more questions. I love the stories in the Bible that talk about leper people. Leper people, they know that they're kind of doomed. They know at that time that there was no treatment for it.
Correct.
They had to somehow make it through life, survive together by the mercy of others, or they had to work in their area to find some food to survive. But I am so impressed with the attitude that our Lord Jesus Christ had towards leper people. In no way he condemned them. In no way he thought that they are like more sinful people than others.
Right.
Anybody can contract it. Nobody is insured. And I will read a short poem that it's very simple, but it speaks volume. It says, "Unclean, unclean," the leper had to say, and sadly watched the people run away. But then to Jesus at the mountainside he came to be healed of all his sickness and his shame. Wow, did you see what Jesus did? He touched the leper from whom they hid. The Holy One touched this unclean soul, took away his shame, and made him whole.
Yeah, and not just that, you really, it's Holy Week, right? So we are looking at how Christ's sacrifice for us paid all of our sins. And if you think about it, Jesus did take away their uncleanliness and, just paid for it with his life.
With his life. And he does that for all of us.
Yes.
We might not have our noses falling apart, our fingers, but sin is the same as leprosy is going to destroy us. And if we maintain any sinful tendency, any hidden sin, not really repenting for it, not really, trying to abandon it, not working on it, it's gonna have the same consequences.
Right. And I think it's great, a lot of times we wait until we're quote unquote worthy to come to Christ. And, just as the lepers, they came just as they were, but God in his mercy restored them to good health. And that's a wonderful promise that we have in Jesus. There's a verse that I also like. It says, "For it is he who wills in you to do and act according to his good pleasure." And I think it's in Ephesians 2:13, if I'm not mistaken. But, for me, a lot of times I feel like, it's hard to want to do the right thing. And, but God says, all things are possible with him. And so I think that, just bearing that in mind and knowing that we are loved by him should make us free.
Should make us free. And now we learn also that pain is not the end of the world. Even if we go and struggle through emotional, physical pain, mental pain, social issues, pain is there for a reason. The only time we will not feel pain is when we are dead. And so God turns every pain. God does not waste any pain. If you're going through pain and you have no hope, mind you, God sees that. God is going to touch you as he came to touch the leper people, as he restored them. He is able to restore us. And even if one day the disease claim our body, yet he will give us a new one at the resurrection day.
Amen.
Thank you. And this was an amazing topic, and we are looking to hear more from you. We are hoping that you can give us a little bit more, enlightenment on many infectious diseases in Guam. We would like to keep the island safe. We would like to keep the island spiritually strong to face all the challenges and also to embrace the pain. No pain, no gain.
No pain, no gain.
And for as long as we, go forward, nothing should detain us or pull us back from God. God has a plan for every pain you're going through, for every leprosy, every leptospirosis, and for every sin or any past mistakes we have done. God has a plan for you. He is the restorer. He is a redeemer, and he can't wait one day to even give us new bodies when we are ready, when the resurrection day comes or when he comes in the clouds.
Amen.
Amen. Thank you, Elena, and thank you, Anna. You can listen to Total Health next week, Wednesday, right here at Joy FM. You have a blessed day or evening. Sorry about that. Thank you.
Be sure to check with your doctors before making any sudden life changes discussed today. Total Health is brought to you in partnership with Guam Seventh-day Adventist Clinic, where health is their mission. We look forward to seeing you next Wednesday. Thank you and si Juas Masi for listening to Total Health right here on Joy FM.